Prevention is a key area, and part of the problem is we don't know very much about what causes it or how it develops. But here's what I would say. I see a lot of people in their 30s and 40s who come for treatment then. And what's tragic to me is I can help their symptoms, but I can't get their life back on course. And so since OCD, half the cases start by age 19, a quarter of the cases by age 14, these people often have been suffering for years before they come for help. So imagine if you get terrible OCD symptoms in your teens, maybe you make it through high school, but you don't make it through college. Maybe you never really move out of your parents' house. Maybe you don't develop romantic relationships and never get married. And again, by the time you're in your 30s or 40s, maybe you've never gotten the job that you wanted, and now in your 30s or 40s, there you are. I can reduce your symptoms, but I can't get you back into your life. And so my urge, in a sense, it's not quite prevention, but if you're starting to see symptoms of OCD, I urge people, go get help then. Go get help when the symptoms are just starting and very mild, because my guess is with the treatments we have, that's going to be all you need. You educate yourself about it, and you make sure that you don't get off track in your life. Typically when the symptoms start, the illness has a chronic waxing and waning course. There are some people who have what I call episodic OCD, that it really comes on in episodes and then goes away. And I think, again, the big, to not have it progress, a big issue is get treatment early so that all the consequences in your life don't start to accrue. Here's an example. Patients who have bad OCD symptoms who are working, but then who lose their job. The illness starts to progress because they now spend a lot more time by themselves at home and do even more obsessing and compulsing, whereas when they went out into their job, in a sense that they couldn't do as much as they used to do, and that's actually good not to be allowed to do as much. So one of the things to stop progression is not to check out of your life. Don't let the symptoms have you check out of your life. Stay in your life, fight for your life, and get treatment.